Nerves are the slowest part of the body to heal. There is always the possibility that leg and bladder control will return with time and patience. In the meantime, dogs do not consider themselves handicapped. They adjust and move forward with the same love and zest for life. After conservative treatment of 8 weeks has been completed, water and physical therapy can be started at a clinic or rehab facility, or even right in your own home. Acupuncture is recognized not only for pain relief, but also for stimulating nerve regeneration. Laser light therapy, although a newer treatment, is also emerging as a good complementary treatment in helping to reduce pain and speed healing and nerve regeneration. After surgery, physical therapy and rehab can begin as soon as the surgeon directs, sometimes days after surgery. At the end of crate rest and after an evaluation of the dog's current level of recovery, that is the time to assess if money is better spent on a wheelchair or therapies to help the dog learn to walk again. Keep in mind, a cart is not for all-day use, but rather a couple of hours at a time. Since a paralyzed dog will use a cart every day, it is better to save up for the best cart you can afford, rather than to purchase one that is ill-fitting, too heavy and inconvenient to get the dog in and out of on a daily basis. A professionally made cart is likely to be a much better product than a homemade cart in regard to pressure points, balance, and stability. Be careful where the yoke or the harness sits on your dog. It should be centered directly over the shoulders. Otherwise, the cart may cause pain or further injury to an IVDD dog. There are 2 preventative procedures: fenestration and laser disc ablation. Fenestration is a controversial procedure among surgeons. If elected, it is done at the time of surgery. Disc material that might escape in a future herniation is removed from adjacent discs. Laser disc ablation uses a less invasive method to prevent future extrusions via insertion of a needle through the skin into the disc and laser energy to liquefy the disc material. The dog must be free of pain and other disc symptoms for 4 weeks to be considered. The facilities where LDA is currently being performed are Oklahoma State University, the Dallas Veterinary Surgical Center, and Buffalo Grove Veterinary Specialty Center. Making some simple home modifications and properly training your dog may help prevent disc episodes and reduce the stress on the spine. Stairs and steps are stressful on the vertebrae and discs. Block off stairs with a gate. Always attach a leash to the harness rather than to a collar. Train your dog to use a ramp up and down from furniture and instead of steps to the outdoors. Implementing these changes in your home when your dog is still a puppy is certainly easier. Even if your dog is currently recovering from an IVD episode, it is never too late to start. You can teach an older dog new tricks. Then, after you've made your home IVDD friendly, relax, and within reason, let your dog be a dog to enjoy life. By becoming educated about IVDD, you empower yourself with the knowledge you'll need to quickly identify the symptoms, crate your dog, get to a vet immediately, and ensure that your dog has the absolute best recovery possible. Being knowledgeable will also help you start looking for a vet that is experienced with treating IVDD, which can make a big difference in your dog's recovery. Starting to plan and prepare now will help you feel in control and ready should your dog start to show any signs of IVDD. And remember, whether your dog recovers via conservative treatment or surgery, there is always hope. We wish you all many years of happiness and long lives together.